When we swallow, food is passed from the mouth into the stomach through a tube called the esophagus. At the junction of the esophagus and stomach, food passes through a ring of muscle called the lower esophageal sphincter. Normally, the lower esophageal sphincter opens only to allow passage of food and drink. It otherwise remains closed to keep stomach acid contained. Stomach acid fulfills an important role in the digestive system. It kills microorganisms and aids the digestion and absorption of proteins, vitamins, and minerals in food. The amount of acid is regulated by signals from the brain as well as hormones produced by other organs. The lining of the stomach can tolerate high levels of acidity, but other parts of the digestive system cannot. Closure of the lower esophageal sphincter is essential to keep stomach acid from damaging other tissues. In some conditions, the lower esophageal sphincter fails to close completely, allowing the acidic stomach contents to flow back into the esophagus, or sometimes even into the mouth or lungs. This is known as regurgitation. The acid attacks the lining of the esophagus, damaging the tissue and causing a range of symptoms that often include burning, pain, and bloating. This incorrect release of acid is called gastroesophageal reflux disease, or Gerd. Failure of this sphincter to close can have various origins, such as insufficient esophageal motility, failing to clear the acidic material, delayed gastric emptying putting pressure on the sphincter, or the existence of a high ischial hernia. By nature, the lower esophageal sphincter is not very sturdy, making some patients prone to Gerd congenitally. Numerous external factors that can be influenced by oneself may also increase the risk of Gerd, including obesity, use of tobacco, alcohol consumption, and patient's diet. Gerd is more common during pregnancy, but symptoms usually resolve after the birth of the baby. Burning and regurgitation are the typical symptoms of acid reflux. However, patients may also experience general symptoms like nausea, asthma, coughing, and chest pain. The symptoms of acid reflux may be classified as acute, sudden and occasional, or they may be chronic, occurring frequently over long periods of time. The nature of your symptoms is important when choosing treatment options. Sometimes patients also have difficulty or discomfort when swallowing, or signs of bleeding in the gastrointestinal tract, such as vomit that contains blood. These alarm symptoms suggest that serious complications of Gerd may be present. If you experience such alarm symptoms, you should seek medical help as soon as possible. Heartburn is often associated with Gerd. However, other conditions such as sclerodoma, hernias, and candida infections may cause similar symptoms. As many conditions can affect the muscles of the digestive tract or delay the emptying of acid from the stomach, it's important to consult your healthcare provider to understand the cause of your symptoms and ensure appropriate treatment. Depending on your symptoms and clinical history, your doctor might request diagnostic procedures such as endoscopy, ultrasound, X-rays, or manometry to rule out other causes of your symptoms. Please follow your doctor and pharmacist recommendations. Indeed, when left untreated, Gerd can lead to inflammation and formation of scar tissue in the esophagus. After becoming chronic, Gerd can also lead to ulcers and increases the risk of esophageal cancer. Steps that can be taken to reduce the risk of Gerd or reduce the severity of symptoms include losing weight and the reduction or elimination of tobacco and alcohol. The association between Gerd and dietary factors may vary between individuals. If your Gerd symptoms occur after consumption of a particular type of food or drink, reducing or eliminating it from your diet may prove beneficial. Food and drinks that may provoke Gerd include coffee and other caffeinated drinks, chocolate, spicy foods, citrus, fatty foods, and carbonated beverages such as cola. Other steps can be taken by patients to reduce the risk of Gerd. If you experience Gerd at night, sleeping with your head in a more elevated position and avoiding large meals 2 to 3 hours before bedtime may help. Certain medications may cause gastric reflux. These include anticholinergics, which are used to manage bladder and bowel problems, non-steroidal anti-inflammatory drugs such as ibuprofen, and benzodiazepines, which are used to manage depression and anxiety. Your doctor can advise you about whether your medication may provoke Gerd and suggest altered dosing or medication if needed. In some cases, weight loss, elimination or reduction of tobacco, alcohol or certain foods and drinks may not be enough to manage Gerd symptoms. If these steps do not improve the symptoms, several types of medication are available. These medications reduce the acidity of the stomach and relieve the symptoms of Gerd. Please consult your doctor or pharmacist for your appropriate medication. The duration of your treatment will depend upon the response to therapy. For some patients, long-term medical treatment may be required to manage Gerd and provide ongoing relief from symptoms.